Nisenan tribe and their future generations who are an integral part of the Sierra College community. Welcome, I'm Judy East and I'm chair of the Nevada County Council of Sierra College Foundation, and we are very pleased to sponsor these community forums. Thank you for coming, and here is Lorraine.
Thank you, Judy. Thank you all. Welcome to this month's topic, Becoming a Top Hospital and a Healthier Community. And my guest today is Dr. Scott Neely. He is President and Chief Executive Officer of Dignity Health Sierra Nevada Memorial Hospital. He is a graduate of the Stanford University School of Medicine and is board certified in internal medicine, pulmonary diseases, critical care medicine, hospice and palliative care medicine. Dr. Neely also boasts a master's degree in business administration, and he has served as CEO at our hospital for the grand total of 2 years and 10 months. He was a previous guest on this forum in October 23. Welcome, Dr. Neely.
Thank you very much. It's great to be back.
So we're going to reserve the last 15 minutes or so for the audience to ask questions if you'd like to be thinking of them. We, of course, don't want to hear if you have a complaint about a bill from the hospital, but if you'd like to ask questions.
See me afterwards.
And there you go. That would inform our community and the hospital and add to the discussion. We would welcome that. And before we get started, I want to put in a plug for next month. We're inviting some of the firefighters who are currently battling the blazes in Los Angeles, and they will be here on stage next month and giving us a look at their successes and challenges and what they learned that we might benefit from. So, Dr. Neely, let's get started. Your appearance here in October of 2023 sparked an initiative that is taking root in Nevada County. In fact, the Board of Supervisors is discussing it at some point this morning, and the program has been embraced by local community groups such as Sierra Roots and Bright Futures for Youth, and it's your brainchild. Will you please explain your concept of health span?
Okay, well, I'm going to go back to the October 23 forum to talk a little bit about that because it was interesting how one thing sort of led to another. We were talking about healthcare finance last year and spent most of our time talking about the very steep hill in front of us in terms of really maintaining robust, state-of-the-art healthcare here in Nevada County into the future, because the finance world for healthcare is not attractive at this moment. It's great if you're an insurance company, but it's really, really rough if you're a provider, particularly if you're a provider who has facilities that require capital investment for upkeep. And somebody asked me, well, if it just looks like costs are going to continue to go up without matching increases in reimbursement, what do you think the solution is? And I said, to tell you the truth, I'm at a loss. I know what labor costs, I know what our supplies cost, and I know what's happening to our reimbursement. And at the present time, the only solution that I can see is to have a decreased need for healthcare services. And that actually got me to thinking, and it got me to reading and doing research and really going deep on the idea of what if everybody were just a little bit healthier, and what if we needed a little bit less in terms of, quote unquote healthcare, which then gets you into the idea of what does traditional healthcare really do and how effective is it? And pretty soon you start to realize that actually the traditional healthcare model is very good at a few things. What it's very good at, though, is predominantly sick care. It's not particularly good at keeping you well, helping you to live a long life, keeping you healthy. Now, if you need to be rescued, you need a healthcare delivery system, okay? And I can speak, very personally about that because I needed to be rescued last year. I had a very serious healthcare issue and I needed surgery. And I went to the best hospital I know to have that surgery done, which was Sierra Nevada. And I'm really fortunate because had I not had excellent rescue care, sick care, traditional health care for that surgery, I probably wouldn't have had as long of a life as I would like to have. You know, the need to have a healthcare delivery system like the one that we have and to sustain it is never going to go away. It's critically important. But we have an opportunity to perhaps need a little bit less rescue care. To live longer, to live healthier, and to live better. And I'm going to pop to a slide that's, let's see. It was working. Okay, that's the way to go. Okay, what this slide demonstrates, it's one piece of data about how we're actually doing at promoting health. And again, we have to start to distinguish between delivering sick care, say somebody who needs a surgery or somebody who needs to be rescued from a serious infection, and keeping people healthy so that they live long lives. Now, we're not very effective at that in the United States. In fact, Americans on average live a solid 5 years shorter life than people in other contemporary, modern, industrialized countries, such as Denmark and Spain and even Costa Rica. And also, we're seeing something very interesting and really concerning in the United States, which is that our health span is actually decreasing. And health span is that part of your life where you are healthy, are enjoying a good quality of life, can be independent, can care for yourself, can enjoy the company of your loved ones. Increasingly, Americans are spending a larger chunk of their life debilitated, chronically ill, not able necessarily to live independently. And that's something that's really concerning and should concern everyone. Now, there are reasons for that, and the reasons are predominantly that we have an increasing incidence of chronic disease in this country. And those chronic diseases include diabetes, heart disease, high blood pressure, vascular disease, cancer, lung disease, obesity. All of these conditions fall into the category of chronic diseases, and Americans have the highest incidence of people with multiple chronic diseases of any country in the world. Now, that's something that it's very difficult for a hospital to address. I am really good at saving your life if you come to me with a serious life-threatening infection or any number of other conditions. We are very, very good at treating cancer. We have a fabulous cancer center that offers state-of-the-art treatment. So we can treat these conditions, but the secret to long and healthy life is preventing those conditions in the first place. And that's why we developed this concept around health span. Listen, I didn't invent this. There are very good positive models of living out there already. And there's very good data that kind of tells you what the practices are that are associated with longer, healthier lives. And so what we're interested in doing is facilitating, helping people, providing a platform for folks to adopt these practices. I was talking to Lori Burkhart Frank on the radio a couple of nights ago, and the way I describe this is, it's simple, it's not necessarily easy. So I don't know if that's a complete answer to your question. It might have been more than you wanted.
Maybe a few details of implementation.
Well, what we are working on right now is really establishing an organization. And the way that we envision this is an organization that is a partner to many other organizations that already exist in the county that are pursuing some of the things that we know help people lead healthier lives. For example, healthy food. Sierra Harvest is going to meet with us next week as our steering organization works through the process of really engaging, talking with, getting good ideas from other organizations that are already interested. In a way, there's an analogy that I think of with respect to healthcare when we're trying to coordinate all these different services, your primary care doctor, home health, the pharmacy, the hospital, et cetera. We call that care coordination. We've got a lot of organizations in Nevada County that are already interested in the things that we know will help people to succeed here. And we think some care coordination might amplify the efforts of those folks who already have, very high intentions to make a difference in people's lives. And some care coordination might result in an even better impact on folks who live in our county. So we've founded a steering organization. We have actually engaged a really talented consultant who has been involved in healthcare and public policy really for his entire career. And we have invited organizations in our county who really are stakeholders in this effort to meet with us to talk more about how we can support them and support the people in our county going forward.
I'd just like to give you a chance to add anything else about HealthSpan. When we chatted yesterday, I was struck by your analogy that relationships and loneliness is the equivalent of smoking a pack of cigarettes a day.
Yeah, let me pop down here. I think that the important thing to take home from this conversation is the fact that the delivery of traditional medical care is critically important, but medicine isn't enough. And only about somewhere in the range of 10 to 20% of our health outcomes are actually related to the medical care that we get. The big chunk of our health outcomes come from our genetics and the way we live our lives. And there are a few practices that are all associated with longer life. And that's on this slide. This slide talks about the Harvard Grant Study, which actually tracked a pretty substantial number of men who went to Harvard or lived in Boston in the 1930s, and tracked these individuals well into their 80s. And what was fascinating in that study is that the single factor that was most associated with long life and self-described good health at the age of 80 was your relationship status at the age of 50, which correlates very well with other science that has come to light, really indicating that folks who experience loneliness have worse health, and that a lack of positive relationships, the presence of loneliness, is as dangerous to your health as smoking a pack of cigarettes a day. So that was that point.
Point well made.
Yeah.
I want to give you a chance to do a little bragging as the patriarch of the hospital, if you will.
I love that, patriarch. I don't think patriarchy would go well with some of my...
As CEO, you told me you've prioritized safety and quality of care and positive experiences for the patients, and for that the hospital has been acknowledged and rewarded.
Absolutely. And this is kind of the starting place there, how we think of kind of a three-legged stool. The multitude of resources that are really required to support people in healthy lives. First one is a hospital. The next one is providers, and I've kind of indicated that on this little cartoon as well. And the next one is our wellness practice, how we live our lives, you know. So connection, food, activity, but also having a healthcare delivery system that promotes that as well. And when you think about hospitals, I haven't gotten the direction for this down. When you think about hospitals, I can tell you as a physician who has practiced predominantly in hospitals for the majority of my career, the first thing that you want is a hospital that is safe, where you can go and not have concern about somebody making a critical error that harms you. That's the foundation. That's the first thing. Safety, an assurance that the hospital is committed to the highest quality care, and a hospital that is committed to treating the people who need us with love. And that's what we've committed to at Sierra Nevada. It's not that quality and safety weren't important at Sierra Nevada before my team kind of came to be over the last 3 years. But we've made a very, very dedicated commitment to actually being the very best hospital that we can be. And that has involved intentional practice. It starts with our safety practices. There is a sort of an area of practical science called high reliability organizing, which includes a number of practices designed to get those safe outcomes. Practicing a certain level of awareness, attention to detail, really supporting people in reporting concerns. If your staff is afraid to talk to you, they're not going to report concerns that they think might lead to harm. And so transparency and building confidence that people can report concerns, report errors without a fear of retribution, and then implementing standard work processes that we know will get a good result. And an example that I've given my team is just the experience that I went through in undergoing major abdominal surgery in November. I observed more than 20 sort of standard work practices that were directed towards me, all of which were designed to ensure that I had a safe outcome from that surgery. Things like checking my identification every time I got a medication. Things like giving me a shot before surgery to prevent the formation of blood clots. Things like making the thing that I keep teasing my team about is they made me a high fall risk, which is a designation meaning that you're at increased risk of falling and hurting yourself. I woke up and I said, it says high fall risk on the board. I'm not a high fall risk. Oh, yes, you are. So I had little booties on my feet, to make sure I could walk without slipping, and a pad on the floor, so if I did fall, I wouldn't break my hip. Those pads prevent hip fracture, I can tell you. So we've done that, and we've worked really hard to improve the safety and the quality of care at the hospital. And as a result of that, we've achieved really impressive numerical results in terms of the type of harm that you can measure. Things like fall with injury, things like hospital-acquired infection, where we have results that place us in the top, in some instances, in the top 1% of hospitals in the nation for things like hospital-acquired infection. And those efforts have resulted in us over the last 2 years receiving a number of recognitions that frankly we never earned, we never received before at Sierra Nevada. It started with what's called the Leapfrog A safety grade. We were always a B or a C before. And we have achieved a Leapfrog A safety grade for the last 3 grading periods, which is there's one every 6 months. The Leapfrog organization is a patient safety watchdog group. It's national. They ask all hospitals to report data to them. Most hospitals do because, you know, it's an organization that people really pay attention to, and not having a high Leapfrog safety grade is something that raises concerns in communities, with payers, with patients, and so it's an important sort of mark for us to hit. But Leapfrog offers one more prestigious recognition for hospitals that not only achieve A safety grades, but go an extra step further in terms like their mortality rates, their staffing, their reporting practices for errors. And those are top hospitals. There are only 15 top hospitals from the kind of rural category, top rural hospitals in the United States this year, and Sierra Nevada is one of them. That's the second year in the row that we've earned that recognition. And that's not like the U.S. News and World Report top hospital thing. That award comes from asking people, well, what do you think's a good hospital? And they say, well, UC Davis. But they have no idea what UC Davis's actual results look like, because they don't require those outcomes in order to designate you a top hospital in U.S. News and World Report. Leapfrog, on the other hand, is entirely based on objective data, the same objective data that we, for example, report to the Centers for Medicare and Medicaid Services, who, by the way, gave us a 5-star rating this past summer. First time we've ever received a 5-star rating, and again, a very prestigious achievement that comes from objectively doing a good job of keeping people safe and delivering high quality care. So we're very proud of these accomplishments. That what it means is that people who need hospitalization in Nevada County or surgery, we do a lot of outpatient surgery and outpatient cancer care as well, but people can be assured that we really are making the very intentional efforts to deliver the highest quality and the safest care that we can.
Congratulations.
Thank you.
On all those awards.
Thank you.
I want to delve into a couple other topics that we didn't discuss a year ago when you were in this forum previously, and then we can return to, I know near and dear to you, are statistics and the finances and whatnot. The hospital conducts training with law enforcement and first responders to prepare for catastrophic events, be it a mass shooting or a natural disaster with casualties. Can you let us know how are those trainings going, and how would you rank the hospital in preparedness for these types of events?
That's a great question. It's work that we really love participating in. We feel that our relationships with the public safety organizations in the county are excellent. We do conduct drills on an annual basis. I think it's actually more than annual, to go through our practices and procedures for things like, for example, a major chemical spill or some sort of environmental disaster. A fire, would be another one that we really do have to be concerned about up here. And we have resources in the hospital, just like the county does, that are dedicated to emergency planning and preparedness. And that goes really hand in hand with our other safety programs. We do training of our entire staff on an annual basis, both to make them aware of how we'll work together if we ever do, God forbid, face a major natural or man-made disaster, or, for example, again, God forbid, if we have something like an active shooter. So there's a lot of training that we do on a regular basis. We feel like our collaboration with Grass Valley PD, Nevada County is outstanding. Now, where we rank, I actually don't have the numbers on that one. I just know that our team feels like we really get what we need. and have great collaborative relationships with public safety in the county. And so,
you'd say the hospital is prepared?
yes.
All right, excellent. Anything else you want to add to?
So an example of something that we weathered, we had Snowmageddon 1 and Snowmageddon 2. But Snowmageddon 2 was a truly massive storm. There's lots of folks in the room who were housebound for, perhaps at least a week, and I know in some cases a couple of weeks as a result of that storm. And you can imagine that in an event like that, just getting people to the hospital to work in order to take care of people can be a dicey situation. We didn't miss a beat because of the collaboration between us and the city and the county. The roads around the hospital were clear right from the start, and they stayed that way. And we had public safety officers going out to employees' homes with four-wheel drives so that we could get physicians and staff to the hospital. And I think, provided not only great medical care, but we were also a warming facility during that event. And so, we've been tested before and performed really well. So I feel confident about our preparation.
I appreciate that concrete example as
Yeah.
well. Another topic, the Department of Homeland Security under the new administration has lifted ICE prohibitions from entering what they're calling sensitive areas, and so ostensibly immigration and customs enforcement officers could perform their duties at a school or perhaps even at a medical facilities such as a hospital.
You got to that one real fast.
We've
I'm
been
impressed.
talking for half an hour.
Yeah, I'm impressed.
I'm sliding into these. How is the hospital preparing?
Did I warn you yesterday that I'd been spending time on that when we talked?
I believe you did.
I think I tipped my cards.
I would never ask you a question for which I did not think you were fully prepared. So how is the hospital preparing for this eventuality should it occur?
We are very actively going through this executive order and analyzing its legality, doing a crosswalk between this executive order and other things that we know are the law. For example, we have a very, very strong responsibility to maintain confidentiality for anybody who comes to us in need. So we can't just start sharing patients' information with ICE officers should they show up at the hospital. Our company is doing a very careful analysis of this executive order because it's very concerning. It's concerning because if this actually gets traction, we may see situations where people who really need medical care don't seek it because they're going to be afraid they'll be exposed to immigration enforcement officers. And that worries us a lot. So we think that our response to this needs to be very thoughtful, very careful, very intentional. The thing that we have begun to do in the immediate time frame is to ensure our people that we don't take immigration status information as part of the medical record. It's not relevant when somebody comes to us and needs medical care. We're not going to put it as a permanent part of the medical record, and we're going to keep medical records confidential. We will be working on other steps, but we're a 140 hospital organization, and we feel that it's very important that we move kind of as one in this situation. We have a mission to care for people no matter what. And, having law enforcement show up at healthcare facilities in an attempt to apprehend people who may be breaking the law, may be a priority that some folks think is important. We don't think that supersedes our mission of making sure that people are cared for if they need care. And so our response to this, as I said, it has to be legal, it has to be thoughtful, and we're working on that right now. But the most important thing that we can do in the short run is to reassure people that when they come to us in need, we're going to take care of them, and we're going to respect their right to confidentiality of their demographic and medical information, because that's also the law. And that's actually a law that's been passed by Congress.
When we chatted yesterday, you mentioned that it might come to, okay, let's see a warrant with a specific name on it.
We do think that that could be part of what is going on. We don't know if it's legal for law enforcement to come and just start asking people for identification in an emergency department waiting room. I'm telling you, I don't know. I'm not going to express a lot of opinions about that because that's not needed. But it may be the case that if the government takes the extraordinary step of lifting this ban on immigration officers in healthcare facilities, that is an extraordinary step. It may be that if they do that, there will be a further requirement that they have some probable cause and be looking for a specific person. We don't know how this is going to pan out. All we know that, we're responsible for obeying the law, and we will. And we're also responsible for living our mission of caring for the people in our community and providing the best care possible, no matter what.
Thank you. Let's go back to the COVID pandemic. What lessons?
Oh, good.
What lessons did the hospital learn from that? What changes were made during the pandemic? And of those changes, are there any still being employed today?
Any still being employed today? That is a really good question. I think that we did make some modifications in our infection prevention standards during COVID, and we still are doing some of that. We test patients for COVID as well as other respiratory illnesses that are communicable, and we don't cohort them together. But many of the things that we did to prevent folks from entering the facility who might be actively infected with COVID, those practices have been relaxed because we don't really think that they are providing value anymore. What did we learn from COVID? I think I'm better off saying, what I learned from COVID. What I learned is, number one, the science still matters. Sadly, I think a lot of people came away from the COVID pandemic thinking that science doesn't matter. And that's not what you should take away from the experience that we had. The science mattered a lot. We had more deaths in the United States than we should have. And those deaths occurred disproportionately in areas where people were not getting vaccinations and not following the best practices. Now, I also learned that we're not always right. We may think that a practice is beneficial and it may have unintended consequences. I think that, for example, in terms of the issue with schools, we may be learning about the outcomes from that for a long time to come. I think people made their best judgments in real time. I think people were very well intentioned about the practices that were adopted to try to keep the virus from spreading as quickly as it was. One of the things that probably some people remember, I remember really, really well, is that we were becoming overwhelmed in the hospital. We were losing our capability not only to care for people with COVID, but to care for people with other conditions. And we know that people died of cancer, died of heart attacks, died of other medical problems because they didn't get care promptly, because our healthcare system was overwhelmed with COVID patients. And they either couldn't get care or were afraid to go to the hospital. And so it was imperative at that time that we slow down the flow. We had to protect the system's ability to care for people who were acutely ill. And so, we learned that we're not always right, but we also learned that science matters. We have to have the ability to ramp up our resources very quickly when the next pandemic comes, because it's not if, it's when. The incredible scientific tools that we have at hand for saving people's lives in situations like that, vaccines being the foremost among them, are really important and can save entire communities from suffering. So,
Sounds like the hospital and you learned a lot from that.
yeah.
We're on the other side of that, thank you.
It wasn't pleasant. I was a critical care doctor and hospice practitioner in Stockton at the time, which is one of the cities in Central California that was hardest hit. And the suffering that we saw was, something that still, clutches at people's hearts when they think about what they went through. And so, I see folks who engage in sort of revisionist history of what that was like, and it's physically painful to me.
Thank you for your perspective. I want to go back to some of the finances, because I know that's your bailiwick. As you explained to me, and I watched the show you did a year ago with Cheryl, it seems like the root of Sierra Nevada Memorial Hospital's financial struggle is the fact that only 14% of the hospital's patients are commercially insured, and treatments are covered, whereas the rest of your patients are Medicare, Medi-Cal, and the hospital loses money on each and every one of those patients. So that's a big teeter-totter, lean in one way. It's an unsustainable financial model. How long can the hospital survive facing this issue?
I think we're going to survive for the foreseeable future, and that's certainly, the next decade or two. I think there will be incremental changes along the way. We've been asking that very question in healthcare for a number of years now. And what's happening is we're sort of like one of those carts with the big wooden wheels, and we're bumping along a dirt road, and we come to something that looks like we won't be able to get across, and then somebody thinks of something and throws down some 2x6s across that, and we kind of bump up, we get across. But we're not sort of on a jet airliner heading into the future in terms of how we're going to match the revenue needs of hospitals and health systems with the costs. So I sadly don't have a good answer. In healthcare, I literally sit on a Zoom call with 40 hospital presidents from California, and we all kind of go, well, something's got to happen, and that's sad in a way. We should have a strategic vision that gives us complete confidence that we know where we're going, but when your major source of payment is the government, the government is looking to spend less money on health care, and labor demands, equipment demands, pharmaceutical costs keep going up, it's really hard to see what that solution is that allow us to get off the, horse buggy and onto a high-speed rail. We will continue to see a struggle, which will be in many cases political, around reimbursement for healthcare costs, reimbursement of physicians and other providers, and it's probably going to be, a bit of a mud wrestle. I don't expect it to be smooth, easy, or clean. I expect us to be, down in the trenches, fighting for every penny, certainly trying to be innovative and to come up with solutions. And, frankly, health span has been the best solution that I can come up with right now for my friends and my loved ones and my colleagues here, because I think that, the aim is not to have a hospital. Hospitals are something that you have to have, at least right now, until whatever revolutionary technology comes along that replaces them with something better. But the aim is not to have a hospital. The aim is for people to live good lives. Our mission is to help people be healthy. It's not to, be a good hospital. Being a good hospital is part of how we do that. And, being there for folks who need complex care, that's something that we absolutely need to do. But the real aim is to help people live healthy lives.
You're on record as saying the most important thing that our community could do to help the hospital is to stop going down the hill to receive treatment.
Yeah.
My question to you is,
true.
You won all these awards. Is a significant portion of our population still going down the hill? And what is the hospital doing to eliminate the doctor shortage locally?
Great questions. Yes, people are still going down the hill. And they're going down the hill for a couple of reasons. One is that they need a doctor. And that's legit. I mean, I talked to a friend a couple of days ago who really, really wants a doctor up here, and she said, "Is there anything you can do?" Well, there's a doctor shortage, and we're trying to alleviate that. And we've had some success in doing that. We've welcomed 2 new primary care doctors to the community in the last 18 months.
How many patients can 2 new doctors see?
A doctor can probably handle a panel of around 2,000 to 3,000 patients. That's a busy doctor, but so we need more, and we have very vigorous recruiting efforts going on. We have a couple of really good candidates in the pipeline, and we're hoping that we land them. Recruiting is tough. There's a significant shortage of primary care physicians nationwide, and that's accentuated in rural communities because more people still want to live in urban areas. But our recruiting for primary care is it's alive and breathing. And we're doing something else that I think is going to be very important, which is we're training primary care physicians right here in Western Nevada County. We now have 4 family medicine residents. Those are physicians who've completed medical school, but then are doing their specialty training. And we started a family medicine training program, a rural family medicine training program, which began a year and a half ago with our first 2 residents. We now have 4 residents in training, and that program has achieved full accreditation with the ACGME, which is the organization which deems whether programs are worthy of accreditation or not. And we have pretty high hopes that one or perhaps both of our first 2 residents are going to end up living and working up here in the future.
And we do have the Pinecone dividend.
Yeah, exactly. But place-based training is a term that's used in medical academics really results in a positive influence on medical communities, because when people have the opportunity to live and work up here while they're training, they get to know us. They get to know what an incredible community this is, and they're more likely to take the opportunity to stay on when they finish. And we certainly hope that that has an impact. It's an important investment that we're making.
Speaking of investments, right now there's a fundraising effort underway to modernize the intensive critical care unit, and
Well
that
done.
is needed to save lives. I received the mailers. And to save lives, and conversely, it would be implied that lives are at risk if that is not done. And also the Cancer Center faces challenges, the need to replace the linear accelerator within the 3 to 4 years, and that's the piece of equipment that provides the radiation for radiation treatments, and that's a $5 million price tag with another $1 to $2 million in construction. So we've got some pretty big ticket items on the horizon. Where is that money going to come from?
Well, I actually think those are projects that are going to get done. Let me tell you that the ICU project is fully funded by philanthropy. Yes, 100% funded by philanthropy. The Sierra Nevada Memorial Hospital Foundation, some members are here today.
Shout out to Sandra Barrington.
Some members of our board are here today. The foundation has actually raised the entire $1.3 million that are going to be needed for that ICU renovation. It's a critically important renovation. We've called it the head wall project because there's this thing at the top of every ICU bed called the head wall that has things like connections for gas and electricity and so forth. And I think that that has sort of minimized the scope of this project. This is a major construction project to completely upgrade our ICU from 1980s technology to 2030 technology. So very, very much needed upgrade in the intensive care unit. And yes, you need an intensive care unit. We care for very, very sick patients in our unit. There are times when we transfer folks to places that have more extensive specialized services, but it's important for us to have an ICU. We have a great ICU, and this is a much, much needed renovation to make the care safer and to enable our caregivers, our nurses and our doctors, to really have all of the tools they need in order to care for people. So the funding for that one is in place. Foundation did a fabulous job.
Cancer Center.
Cancer Center. See, I gave myself some time to get to that one. The Cancer Center project, I'll be as transparent as I can, and maybe I could have Ed Sylvester come down and finish this for me. But the Cancer Center project is a critically needed upgrade or investment for our outpatient cancer center. Linear accelerators, which are the big, scary devices that produce focused radiation so that you can beam cancers with radiation therapy. Linear accelerators have a shelf life, and they eventually need to be retired and replaced. And ours is a few years from that, but we have to be proactive. And it's really an existential need for the cancer center and the hospital to replace that linear accelerator. The optimistic thing I can say about that is that our company, Common Spirit Health, has heard us, and they recognize that this is a critically important upgrade for our hospital. And we have a term that we use for projects like this, which is the critical few. And that term arose from the fact that we basically need more capital, more investment dollars than we have right now. And so we're working hard to identify those things that absolutely must be done. And our company recognizes that this cancer center renovation is a critically important investment for us. Now, we expect to receive millions of dollars for this project from Common Spirit Health, from our company. And we also expect to have a considerable contribution from philanthropy, from the foundation's efforts as well, but we're going to get it done.
Excellent. I'd like to open this discussion for questions. Dr. Terry McAteer, who usually is in this seat.
So, Doctor, we have one of the lowest vaccination rates amongst our youth in the state, this county. And so I was wondering, since that puts everyone at risk, low vaccination rates, and we even have a greater anti-vax movement in this country than any time ever, what is the hospital in this new venture looking to do relative to increasing vaccination rates amongst our youth?
What is the hospital doing or going to do to increase vaccination rates, especially among local youth?
It's a great question, and I think that, the hospital, being an acute care facility, doesn't necessarily have a primary role. We talk a lot about this on our provider calls, I think the first thing for me to say is that I'm aware that we have a significant anti-vax movement in the county. I actually was not aware that it is a significantly more robust opposition force here than it is in other parts of California. It seems to me that California has an anti-vax issue to begin with. We are always happy to add our voice, and I think as we explore health span, one of the things that we're very interested in is engaging with organizations that are interested in supporting our youth, because I think this starts with youth, and I can't promise anything because this is really a situation where we need community partnership and consensus building, but we will be more than willing to add our voices to any kind of community work aimed at helping people to understand. I think when you ask what I learned from COVID, one of the things I learned from COVID is that you can't scold people into practicing healthy habits if they're convinced otherwise. Shaming people with your MD degree and data doesn't seem to work when you've got these powerful social media forces that are fundamentally in opposition to known scientific fact. But you have to have a way to converse with people and to connect and to communicate. And I'm not saying I know what that is, but I am saying that we will be a robust part of any organized effort to engage with people and to help them understand what their best interest is.
Other questions right here in the red plaid.
I'm wondering if there's a special fire protocol to protect the hospital.
Special fire protocol to protect the hospital. Does it exist?
Yes, there is. We're an entirely sprinkled facility to begin with, and we have water reserves on hand. I am not expert enough to go into the details of what that program looks like, but we do collaborate with our local fire departments in making sure that the hospital is protected in the event of a significant fire.
The reason I'm asking is they always tell you to have a plan, an escape plan, and it seems to me that this area around here where the two big schools and the hospital and a lot of and Eschaton should be the safest place to go. And I just wonder about that.
We think that the hospital space is defensible, and our first fallback is to shelter in place, because we think that, at least early stages, it is a fairly defensible space. We have evacuation plans as well, but those are problematic, as you can well imagine, given our somewhat limited escape routes. But the hospital is a defensible space, and that's our first choice.
Questions? You, sir.
So I represent a group that wants to organize drivers for concerned patrons as far as them transporting to the facility anonymously and going back home. Bring this up publicly, because if there's anyone else who would like to volunteer to be a driver, contact me. And
Thank you.
Is that something you'd like to talk about?
Would you like to see a grassroots group provide transportation to and from the hospital? This gentleman is offering and looking for recruits.
I think that's an incredibly valuable practice.
I'll be keeping it on the down low in anticipation of meeting a lawyer.
Any other
We're-
questions? Yes, sir.
Thank you.
To expand on your comments on lack of doctors, not just PCPs, but also specialists. Are we ever going to see, for example, a neurologist in Grass Valley?
Yeah, you covered that topic ad nauseum about a year ago. Are we ever going to see a urologist in Grass Valley in addition to recruiting other PCPs and specialists?
That's a fairly complex discussion. I think the short answer is I'm not very hopeful. And I'll give you a few facts that may help to explain that. There is a nationwide shortage of urologists, just as there are a number of other specialties. And so urologists are very difficult to recruit right off the bat. The other thing about urology as a specialty is that it's a very technically demanding specialty, and a lot of physicians who are trained in a contemporary approach to urology required very specialized operative facilities and equipment, which tend to only be supportable, or something that you can support in sort of a tertiary or referral setting. So they're going to cluster around referral centers, not around rural hospitals. You might occasionally find a physician who's perhaps a little later on in his career and doesn't want to do all of the things associated with sort of the most state-of-the-art urology practice. We had one of those here for a while. We tried to keep him here, but he chose to move on. He was kind of a special case because he was not somebody who was using all of the available technologies that most urologists want to use in their practice. And so, long story short, I don't want to be too long-winded about this. Despite the fact that I know that there's a lot of people up here who would really like to be able to see a urologist without driving to Roseville, there actually aren't enough patients up here to support a contemporary urology practice. We have looked for a number of alternatives. We've tried to see if we can get somebody who will come up here 1 or 2 days a week. We haven't been able to do that, but we remain open to that. But those doctors can pretty much practice where they want to. And until we find one who, can provide the care that we need, but either be sort of part-time or who is willing to commute up here and do it 1 or 2 days a week, I'm not as optimistic as I'd like to be.
Hopefully that answers.
Do you have a follow-up question to that?
We are out of time.
We're out of time.
We are out of time, and I appreciate your time. Next month, we hope you'll join us when we talk to some of the firefighters who are battling the blazes down in Los Angeles. And will you please give a round of applause to Dr. Scott Neely for being so forthcoming, transparent, and answering all our questions.